Hello, my name is Lisa Deaton. I'm a Louisiana Nurses Political Action Committee contributor and volunteer. As a nonpartisan organization, LANPAC is conducting interviews with candidates for our state legislature. We want to learn more about where the candidates stand on issues that are important to nurses and to the health and welfare of our citizens. LANPAC solicited questions from the nurses across our state, and our Board of Trustees finalized the questionnaire based on the top issues submitted. These questions were sent to our candidates prior to their interviews. I'm delighted to welcome Drew Maranto, who is running for state representative for District 66 in our legislature. Candidate Maranto, I'd like to turn it over to you now for a few opening remarks.
Awesome. Thank you so much, Lisa. As Lisa alluded to, my name is Drew Maranto. I am a candidate for state representative in District 66, which is in East Baton Rouge Parish. I am a native Baton Rouge guy. I went to Catholic High, LSU, got my graduate degree in public administration. A little bit about me and my background. I'm a former public servant. I was an aide in the U.S. Senate for a number of years and have been fighting for Louisianans across our state in a number of areas. Constituent service comes first to me. Like I said, I did that work for a number of years. I'm currently a small business owner in Baton Rouge. We roast craft coffee and work with people all over the state in grocery stores, cafes, and some direct to consumer. I'm running for this office because I feel that it is time for the next generation of leaders. This is an open seat. And so it's a great opportunity, I think, to get re-involved in my community. My wife and I made the decision that we would seek this seat at the beginning or kind of at the end of 2022. So we're trying to get our message out there. We feel that Louisiana is taking a turn. You've heard it before. We are at the bottom of most lists and we have our work cut out for us. But I certainly think that with some policy reform and the right people in place, we can really turn it around.
Well, thank you for those remarks. So now we'll move into the questions. The first question has to do with healthcare disparities.
Mhm.
We all know prior to COVID-19 that we already recognized that healthcare services were not accessible in an equitable manner, not only in our state, but nationally. And then COVID just really shined a light on that issue. Healthcare, though, is only 20% of what accounts for our health status. And the social determinants of health, those non-medical factors that influence health outcomes, make up the rest. What strategies do you have to assist with reducing social determinants of health's impact on the citizens of our state?
Well, obviously, as you alluded, there is a great need for a multitude of healthcare and healthcare related services. I know you said that only makes up for maybe 20% of one's potential health status. But for me, I do think we have to continue to leverage technology. That's not always the easiest thing to do, especially in a state where I will be fighting for more broadband availability. Because as you know, we have a lot of rural communities and a great need there. I plan to partner with Senator Mizell to continue to get those grants out so that people can have broadband access and can connect with their practitioner. We obviously know that if they can get in front of them, that they're more likely to have a better outcome. You alluded to COVID being an impact and maybe people did not have access to what they needed in their community. As I said in my questionnaire, I think the mobile screening and kind of satellite clinic setting we've seen be effective. I'm sure you're familiar with Women's Hospital and their mobile mammography unit and things like that. Y'all know better than I, a lot of people were not able to get normal preventative screenings during COVID, either lack of availability or the office, was only able to see certain patients at a certain time, or folks did not feel comfortable that they'd be able to do that. Another thing that I wanted to talk about that I brought up was we know that there are a lot of communities that face a lack of quality food or access to food. That's way easier said than done. I can't make a business come in and open a grocery store, but I do believe that as legislators, we have a responsibility to create an environment where folks can succeed. Crime and public safety is probably one of the number one things that I hear about when somebody's like, oh, I don't really want to open a business in a particular place. And so we've got to be able to bring some resources to bear so that business owners feel comfortable that they can open that business, particularly grocery store, convenience store that is accessible to the folks in that area so that, whether they're on assistance or not, that they can get food that matters and matters at home. And lastly, I kind of alluded to some wraparound services. I've toured various industries across the state that are working in their community to work on mental health and what I would call ancillary services. When somebody is seeking housing, or maybe it's a drug rehabilitation program or career training, if we can bring them resources so they can check some of those things off their list and feel more comfortable, I think that overall they're going to have a better outcome in their health and their family's health.
Okay, thank you.
Sure.
Our next question has to do with faculty shortage in education. How would you advocate for federal and state funding to support recruitment and retention of nursing faculty to reduce the nursing shortage we face?
Yeah, well, throughout my career, I've had the opportunity to serve in a couple of different capacities, and I have a great, relationship with our federal delegation in DC, which I do think is crucial to figuring out what's that next phase of attracting healthcare practitioners to our area. I spent time with a few different nursing programs, speaking with them at various universities and how they can kind of up their game. I feel like we're on this new phase of competition when it comes to getting good quality, not only students, but then those that can train and teach our students, right, and get them into the workforce pipeline. I know that I can be a good advocate for funding. I alluded to a couple of things with the Board of Regents that I know that they're working on with capitation and partnering with local hospitals in various regions to kind of tighten that pipeline for getting talent right out of high school and into an immediate program. I know there's also a need for faculty. So I think that we have to look at addressing stipends and other sources of funding that we can, you talked about retaining and recruiting. I think we can do both of those if we can strengthen that relationship. I know that's going to look different in various parts of the state, but for Baton Rouge, we obviously have a lot of students kind of matriculating through, but it's my goal to try to keep them here. And so I think we have to have adult conversations about what the schooling looks like, what retaining faculty looks like in terms of compensation, and how we can get increased funds to make that work.
Great. Okay, we're going to move in an area that you kind of touched on in your opening remarks as well, having to do with safety and violence. We know gun violence continues to roar through our communities. I mean, with shootings happening in houses of worship, schools, shopping malls, throughout our communities. What factors do you see as critical to bringing an end to these senseless acts? And then do you have any strategies on how to address the problem?
Yeah, Lisa, this is tough. It just touches so many communities, not only in our state but across the country. Our youth, I feel, continue to fall victim to a broken system and the breakdown of the American family. As a legislator, we can't legislate how somebody lives, but I believe once again we have to try to create a community where they feel safe and can live the life that they want to live. I'm fully supportive of school choice because I think the education component here cannot be understated. We know that just from data, if you are literate and hitting the marks in grade school, you are way more likely to have a good paying job with better benefits, and that you're not being left behind to a potential life of crime. I think that is number one. Something that I don't hear a ton of my potential colleagues talking about that I think we absolutely have to talk about is mental health. We know, Pat, during the pandemic and afterward, that there is just a great need for those services. I talked about it in a previous response to y'all about having some wraparound services and access to that. Private pay is not an option for everybody, and I think that we have to work as a state to determine what we can bring to bear for the folks most in need. I'm not saying I can fix that on day one, but I think talking about it and getting like-minded folks in the room and working with the people that are doing this on the ground every day is huge. I mean, school counselors, you name it, like it's all part of that. And so I think talking about education and mental health can keep people out of a life of crime and can make them more productive in society. We've got to get back to community policing. And, I'm not talking about just doing events for social media. We've got to have more folks in the community. I have personally met with our sheriff here in East Baton Rouge Parish and his team about what we can do to get more folks on the ground so that we can make our communities safer. But we have to fully fund our law enforcement. We have to also retain and recruit good talent so that these police departments can be world class. I know we can get there. My dad was a sheriff's deputy his whole working career. And so I know what these men and women are facing, and I plan to be a partner with them so that we can, in fact, make our schools safer and our communities more robust so that we can all succeed.
Okay. The next topic, the next question is in that same topic about rapid fentanyl test strips. We
Sure.
know they can be used to detect if drugs have been mixed or cut with fentanyl. We know the important information about fentanyl. Healthcare providers can take steps to reduce the community risk of an overdose. How would you support legislation to make rapid fentanyl test strips more readily available?
Yeah, I think as you laid out, this is part of um, a continuum, to give people the tools they need, especially our healthcare practitioners, to detect it if it's in a pill that a patient may be taking or in something else that they've been exposed to. I had to do my homework on this. I realized that there was a bill, to remove it from the drug paraphernalia statute in 2022. I support that. I do believe the federal government has brought some programs to bear in terms of grants that facilities and community health clinics would be able to, make those strips available. One of the things that I'm seeing in talking to our law enforcement community is these pill presses from China, and folks are, getting pills that they would maybe normally take, sometimes illicit, but like they're being, compounded with fentanyl, and it is just it's just a horrible crisis on our streets. Um, and so, yeah, I mean, to basically say simply, yes, I think if we can, make them more readily available, hopefully we can help somebody along the way. I mean, I think that's what it's about. And then getting them what they need, as another part of this process. I'm also committed to increasing our funding and work to help our law enforcement officers interdict these types of drugs so that we do not face a continued opioid crisis in our state. I think we have to take a really hard look at how we're able to interrupt the flow of drugs into Louisiana. With I-10 coming through, it makes us very susceptible to drug and human trafficking, both horrific things that we're seeing people fall victim to every day. And then lastly, I just wanted to mention that I think some drug diversion programs would also help folks that are in this vicious cycle of going to jail for recidivism with drug-related activities. I think that if we could get them into some better programs at the start, they'd have a better outcome overall, and we can get some of these drugs off our streets.
Okay. Now we're moving into one area related to access to care. Are you supportive of actions to remove arbitrary barriers that prevent all healthcare providers, including advanced practice registered nurses, from practicing to the full extent of their licensure, education, and training?
So, Lisa, a couple things here, and I was pretty honest in my questionnaire because I want to be as helpful as possible to as many nurses and healthcare practitioners as possible, because the ideas come from you all, right? We have to work together to figure out what is going to be best for our practitioners and our citizens, right? And so I want to be transparent about that. I think that Louisiana in particular is known for being a little cumbersome on licensing and occupational licensing. And I know that that is something that has been worked on the last few sessions. And I hope to partner with Representative Emerson to keep working on reducing barriers for folks to be employed here. And the reason I bring that up is because if a spouse is moving here for a job, and let's say that the wife or the husband is a nurse, one, we need to make it a little easier for them to come in and get a job because they're already licensed somewhere else. But I think that we could not run this world without our nurses. I said it in my questionnaire. I'm going to say it again. We can all name somebody that's a nurse that's probably made a significant impact on our life, whether it's a family having their first kid or a child with a serious illness. Most of us have been touched in a particular way, in a special way by our healthcare practitioners. I think that part of the conversation needs to be, what do we expect educationally from these degrees? What is in a particular degree program that would allow somebody to administer medication or work alongside a physician? I think we just really need to have a conversation about what educational components do we want to see so that we can have qualified healthcare practitioners and folks that are empowered to do what they are trained to do. And so I don't want to see any more, arbitrary barriers. And I want to give folks the power, but I do think we need to do that responsibly. And I said it in here. I want to work with y'all on what you think is best so that we can move forward, because I think right now we are stuck, and I don't think that's helping anybody.
Okay. Our next two questions are basic general questions. The first one gives you an opportunity to tell us what your legislative priorities are if you were to be elected.
Sure. I didn't want to be too long-winded or give you a huge list, but there's obviously some things on my mind and things that I think I can work on. I'll just hit some high notes for you. Tax reform, I think that's just important because we continue to see folks leaving the state in search of communities that have a simpler tax code, less of a burden, but seem to provide more services. One thing that I speak about often is the need to provide value. And our taxpayers need to see what that vision is. We absolutely need to um, work on the income tax, whether that's a phase out or a drawdown, however that, looks. And then, I think our locals need to be empowered to raise the funds that they need to provide the services that we expect of them. Public safety, bolstering our law enforcement community. I talked about that a lot in this interview, but I am 100% committed to making sure that our police departments are world class. I will work on that on day one. Insurance reform and relief. We know people all over Louisiana that are dealing with this. We have got to increase competition. I think the fortified roof program can help bring down some premiums. But once again, we've got to tell folks that these things are out there and that they're able to access that. And then I also want to focus on energy production in the state of Louisiana. Louisiana wouldn't be what it is without our oil and gas workers and that continuum. And so I'd like to see us continue to strengthen that. And then lastly, I had alluded to Senator Mizell earlier, but I hope I get the opportunity, should I win, to work on a maternal fetal wellness task force. We know that there is a great need there as well, with outcomes for both pregnant mothers and kids being born in Louisiana, whether they're in the NICU or need other things after they are delivered. I just think that we have to talk about this, and I'm committed to working with Women's and our other partner hospitals to make that happen. And then real quick, I'd be remiss if I didn't say we can work on lowering our prescription drug costs, and especially for our Office of Group Benefits beneficiaries, because we know that folks on a fixed income, and I mean, let's face it, most Louisianans are dealing with increasing drug costs, and I think that we have to attack that head on. We cannot let big pharma take our health care from us.
Okay. Why should the Louisiana nursing community support you as the best candidate for your district?
Well, I'm a small business owner now, and I'm seeing the need firsthand for improvement on a multitude of levels. Yes, I was an aide in the U.S. Senate, and I put that work behind me, but now I feel more called than ever to step in for my community and my state. I believe we need leaders who've seen firsthand what our communities are facing. And I think it takes somebody that is ready to fight on day one to do that. I think I'm the best choice because I am that leader. I've spent years fighting for Louisianans. I've helped our veterans obtain health care and advocate for them when they needed it most. I've helped our state recover after multiple disasters. Everybody, almost every parish has experienced some form of disaster in the last 10 years. And I've been on the front lines proudly to try to get them the resources that they needed. I've learned a great deal about healthcare and the healthcare apparatus in our country and our state through that work. And I'm ready to work with the nursing community to keep achieving results. For these reasons, I think I would be an excellent choice and would appreciate your support.
Okay. Well, we want to thank you for taking time out of your busy schedule, as I said earlier. And we'd like to give you a minute or two for some closing remarks.
Sure. I won't be long-winded. I think I said a lot of what I'm about and who I am. I know I would be a good partner with your organization. As I said before, I do have a lot of experience, not in being a practitioner, but seeing practitioners and talking to them about what is working and not working in their communities. I believe that not only my work, but understanding and work ethic will benefit our community and our state. I would just appreciate your consideration, and I look forward to working with you.
Okay. Thank you, and good luck to you as you continue with your campaign.
Thank you so much, Lisa. Appreciate you.